But I think it's just important to say that there are obviously a lot of weight management services that each individual may well be eligible for. And I think our role as clinicians is to support people to find the right intervention for them at that specific moment in their lives. Next slide, please, Onik. Fab. So just a few fundamentals. So for this specific program, there are quite strict eligibility criteria, and adults need to be living with obesity as well as having a diagnosis of either diabetes or hypertension or both of those comorbidities. So we're talking about a specifically comorbid population. This is available in all general practices. And the referral is through the e-referral system, which we'll come on to a wee bit later. It helps people to access essentially a tier 2 weight management intervention, so a 12-week behavioural lifestyle intervention. And to use it, a service user needs to be able to use an app on their phone or a web-based platform on their computer, and they need to have a phone number and an email address. And perhaps obvious, but this is provided at obviously no cost to local systems. Next slide, please, Onik. So there are 3 levels of intervention, and I'll come back to why that is in a sec, but essentially at level 1, someone would use a purely digital intervention that they can use where and when they want to. And then you've got level 2 and level 3. That includes both that digital experience that you can do where and when you choose, but then in addition to that, someone would benefit from at least 50 minutes at level 2 and at least 100 minutes at level 3 of virtual human coaching. And the hypothesis here is that we know that people engage and derive outcomes to varying degrees from weight management services. And there are specific populations who find it that they engage less well and derive less good outcomes. And so what we're trying to do is to support people through this coaching, and there's evidence to suggest that this helps people to engage and through engaging to derive better outcomes from this sort of program. Next slide, please, Onik. So in order to decide which of those 3 levels someone would access, we use a triage function, which to someone accessing the program, they won't really be aware of that they're being triaged. But the triage is based on their demographics, so their age, their sex, their ethnicity, and their deprivation. And we've used information and data from the NHS Diabetes Prevention Programme, which essentially is also a weight management intervention, to make a proxy assumption as to how well we think people will engage in this program. So that in the DPP, the Diabetes Prevention Programme, we can say based on ethnicity, age, sex and deprivation, how well they'll engage. And then we make an assumption based on those criteria in this program. So that the people who we think are going to engage less well, and to stereotype, that would be a young man of non-white ethnicity living in a deprived area, so that those people would access the more intensive level 3 intervention, in which they would be offered coaching, which hopefully will support them to engage better, give them a more personalised experience, and ultimately to help them derive better outcomes from the programme. Next slide, please, Onik. Thanks ever so much. So just to cover the referral pathway, a patient or service user would be identified in a general practice, and really important to say that it's obviously not just GPs who are able to have these conversations and to, yes, they are free, Linda, to answer your question that just popped up, that any member of staff that feels they can have a conversation with the patient is able to, and to make a referral into this program. Someone would then their referral would go to the referral hub, which essentially to a patient would just be a series of screens on their phone, which I'll show you in a mo. And they would be triaged based on their demographics, and they'd be allocated to one of the 3 levels that I mentioned. At each of those levels, a person or service user would have a choice of at least 3 different providers to choose from, and they're provided with some information in the app on their phone to decide which of those providers would be most suitable for them at that time. They then go through a 12-week intervention, and their data around their outcomes is fed back to the referrer in general practice, and we use it for evaluation, obviously. Next slide, please, Onik. Thank you. And this just sort of shows what that service user experience would be. So upon referral, someone would receive a text message within about 2 days after to welcome them to register with the program. You see the screens they would see. They'd enter their date of birth. They'd also confirm their ethnicity, because that information is so important in this program. They would then be triaged and be offered a choice of interventions that the names on the screen obviously don't represent the providers, but essentially they can see information about each of the providers at their level. They would choose one of those providers. Their information would be fed on to the provider, who would then contact them in about 7 to 10 days. Next slide, please. I mean, this is a quote from a GP who's been really kind and supportive of the programme up in the northeast. And Becky, her experience was in an area where they didn't have weight management services at Tier 2 at the time. And so she said that the NHS Digital Weight Management Programme came just at the right time. We're finding a lot of people are motivated to make changes to try and lose weight and feel more healthy after lockdown. We've had a really enthusiastic response from people who are happy to use online options. Fab. Thanks, Sonic. Next slide, please. Great. This just shows, and we'll send this around, it's not, but this shows the providers that are available at each of the 3 levels. Next slide, please. Lovely. And then we'll send this around. These are just contact details, just in case patients are coming to you saying we're having problems. This you can just pass them. So we don't want you to be having to spend your time obviously trying to contact the programme if at all possible not to. Next slide, please. Fab. And I guess important to say that this is one of many offers that will be available in your local area, and that range and landscape of offers will vary. And that given that this has quite strict eligibility criteria, and also is a digital intervention, we're really aware that lots of people won't necessarily be best suited to this intervention or vice versa, but to say that there's huge capacity here, and we've got a great opportunity this year to help as many people as possible access an intervention which we hope and are starting to see will help them derive benefits. Next slide, please. So there's a lot of information on here, and it's probably, I mean, if you will just let me talk through it. I think we're starting to see information about which population groups, demographic groups are accessing this programme. And that information, I think, is really heartening and exciting and says a lot about the role of general practice and the impact that general practice referral makes on those who access weight management interventions. So alongside this intervention, we've also offered this programme to all NHS staff who live with obesity. We've not been so specific about what eligibility criteria they have to have. They just have to be living with obesity. And that's a self-referral route. And if of interest, please just say, and we can put the information around that into the chat. Jane, you'll kindly do that, I'm sure. But what we know is that, and what we think and have seen before, is that actually when you look at general practice referring, you see a more equitable population accessing the weight management intervention. So this looks at age, but just before we go on to age, if we look at gender, if you look at the people referring themselves through the staff referral route, we're seeing, I think, about 90% of females accessing the programme. In contrast, through the GP and general practice referral route, we see about 60% of females accessing the programme. And so you're seeing, by virtue of the general practice role, that quite a lot more men are accessing programmes, and we know that men are less likely to access these sorts of programmes. So that's really encouraging. Secondly, from an age perspective, the blue line shows the general practice referral route, the purple line shows the staff referral route. In terms of general practice role, we're actually seeing fewer people at really young ages accessing the programme, but that possibly reflects the kind of population cohorts that are being accessed, that are accessing the two. Next slide, please, Jane. I think the next slide is really interesting, and so if we look at different ethnicities, we see, so in blue you've got the general practice referral route, and then in purple you've got the self-referral route that staff can access, and then in grey we've got the general adult working population. So if we look particularly at people of Asian ethnicity, we see almost about twice as high proportion of people accessing the programme of an Asian ethnicity. That plays out also for people of Black ethnicity. And so essentially the takeaway is that by virtue of general practice getting involved here and referring in, we're seeing more people from BAME ethnicities accessing the programme than we would if it was a self-referral route. Next slide, please. Fab. And then there's a sort of similar story in terms of deprivation. So if we look at the purple boxes, which is self-referral and of staff, we see relatively equal proportions of people from the 5 different deprivation quintiles accessing the programme. However, if we look at where general practice refers, we're seeing higher proportions of people from the most deprived areas accessing the programme, which from my point of view is really encouraging in helping to ensure that we affect and if the inequalities in people accessing these sorts of programs. Next slide, please. Fab. Jane, I think you're going to take over at this point and talk a wee bit about some of the challenges we've seen and just try and give a few top tips in case it can help people who are kind of giving their time to refer in.
Yes, thank you, John. And thank you to everyone for engaging with the Digital Weight Management Programme so far. As this programme is new, we understand that there have been some challenges in making referrals. So we've come up with some top tips to help practices overcome these, whilst we also work to improve technical aspects of the programme. So first of all, remember that patients are only eligible for the programme if they are living with obesity and also have a diagnosis of diabetes or hypertension or both. If this isn't completed on the form, it might be automatically rejected sort of back to your practice. Secondly, to make referrals via eRes, you need to search for Midlands and Lancashire partnering NHS EI within the dietetics, and we're going to be watching a video after this, which will show you how to find it.
You just said if they have obesity or have other issues like diabetes or hypertension or both, but actually this says that it's only for people that have obesity and diagnosis of diabetes.
Yes, that's correct. So they need to have obesity and a diagnosis of diabetes or hypertension or both. Yes, apologies. So we're going to be watching a video for that top tip number 2, which will show you how to find it in eRes. Thirdly, there's no need to change the standard template. There's also no need to override the auto-populated text within the template, and the referrals don't need to be sent to the National Digital Weight Management Programme team via email or be printed out or scanned in. And I think those are all the top tips. Thank you, Onik. Next slide, please. So we've published these tips on our website, and as these slides will be circulated round, you'll be able to access this infographic to help you. And next slide, please. We can now watch the video, I think, Onik, from about halfway through, because in the interest of time, if you go to about 3 minutes in, I think that's where the most useful part of the video is.
Is it this one?
Yeah, that looks about right. Yeah, if
Okay.
we go from a little bit after that.
The document properties box will now appear. Click on the magnifying glass to search for the document type. The code selector box now appears. Click in the search field and enter the search term weight management. Select the refer to weight management program code. Then click the OK button. The code now appears in the document type field, and I'm just going to click into source. I'm going to select NHS e-referral service from the list of options. If it doesn't appear in your list, click on the magnifying glass next to source and search from there. Click OK to confirm the document properties. The document is now added to the patient's record. I'm just going to click on the Add button once more. This time, I'm going to select Referral from the list of options. Select the NHS e-referral option, and now select Routine Referral. Select the appropriate clinician from the list of referring clinicians. Click OK. The clinical information checkbox now appears. Just to make sure that you are happy to proceed, click Yes to continue. The next step is for the e-referral form to appear. I'm now going to select the initial referring clinician field. For this example, I'm going to select the clinician Emma. Now I'm going to select the e-referral priority. For this demonstration, I've selected the routine priority. Now I'm going to select the appropriate specialty. In the list of options, I'm going to select dietetics. Now let's select the clinic type, and I'm going to select the weight management clinic. Now let's scroll down. I'm going to click in the organisation or site name field and type in Midlands and Lancashire. From the options, select Midlands and Lancashire partner NHS EI. Once that's selected, click Done. We're now ready to select our service, so click Search All. Happy that we've selected the Digital Weight Management Programme, we're going to click Send for Triage. The Review Referral Criteria box now appears. If we're happy that we've selected the right services, we can click Continue with Selected Services. Check your patient's details are correct and click OK. We can now send the e-referral by clicking the Submit button. Confirmation that the triage request was successfully submitted is now displayed. To continue the process, we now click Please select an action. From the list of options, choose I have selected the service. Now click OK and click Yes to confirm the service selection. The complete referral details box appears. Click into the clinical term field. In the code selector, I'm going to search for the weight management code. Now select the Refer to Weight Management Program code. Just going to click OK to confirm that, and then click OK once more to confirm the referral details. The next step is to click into the free text narrative box and type in Please see attached. Now click Clinical Content on the left of the screen. In the Risk to Others section, which is at the top, click All Risk to Others. Now click Attachments, which is at the bottom of the list. Next, we need to select our Refer to Weight Management Program document. So just going to tick in the box. We can now send the letter by clicking the Authorize and Send button. Confirmation that the referral letter has now been sent is displayed, and the process is now complete. Thank you for viewing this e-learning demonstration brought to you by Midlands and Lancashire CSUIG training team on behalf of NHS England, in which we looked at EMIS Web Referral to Weight Management Programme process.
Thanks, Onik. I understand that that video was quite small and difficult to follow at times, so I have put the link in the chat and it will be available after the webinar.